Hi. Just wanted to talk a little bit about why we need to shelter in place right now. Not go out, not go to the store, not visit with friends. Sit, stay, and get away from people whenever possible. Not a little bit, a lot of it. Seriously. Why? It all has to do with exponential growth. And it's alarming when you understand what it means. So let me explain. In the United States, we have about 100,000 ICU beds and nearly 1 million hospital beds. And at any one time, these things are fairly full, like where most of them are in use in one way or another. And these numbers are a little bit higher than we actually have available. But let's say we can spin these up and get them working really quickly, and then add to them from Department of Defense and other stockpiles where we have emergency field equipment. That's what we've got. So so what does that mean? Well, what we know as of today from the data, roughly, is that for every 100 people who have COVID-19, 20 of them are going to need a hospital bed where they can get IV fluids, oxygen, and other things to help them through this infection. And 5 people are going to need an ICU bed because the disease, which is pretty much a lung disease and causes lung symptoms, they're going to need to be highly oxygenated, and some of them, let's say 2, are going to need ventilators. Meaning they're going to be put on a machine to breathe for them, help them breathe through the worst part of the disease. As their lungs heal, the body heals itself, and they come out of it, as most do. Because out of 100 people who have this infection, about 1% die. Now that's variable. That could be as high as 5% or higher if we don't stay where we are right now. It's the last chance to do it right now. And that is because you have 1 death. Because what that means is while we don't know how many cases there are out there, our testing isn't good, we're not revved up yet, we'll be there, but we don't know yet. So we really have no idea how many true cases there are, but we know how many true deaths there are. And as of this filming, there are 150 deaths reported in the United States as of today. So if we extrapolate that to say, well, okay, how many ventilators today are being taken up by people with COVID, we could say, okay, there are 300 ventilators today being taken up. And how many ICU beds? Well, it's 150 times 5. That's how many ICU beds are currently being filled. And how many hospital beds are being used for COVID patients today in the United States would be 150 times 20, or 3,000. So there are 3,000 hospital beds currently taken, 300 people are on ventilators, and 750 people are in ICU beds. So, okay, that's today. Now the real key here is how long does it take the death rate to double? So how many days will it be before we're having 300 deaths a day? Will it be 1 day? Will we have 300 deaths tomorrow? Will it be 2 days? Will it be 3 days? Currently, it looks like it's about 5 days. It's the doubling rate in the United States. 5 days to go from 150 deaths a day, which is today, to 300 deaths a day. So let's say this is 5 days from now. And let's say the doubling rate continues because people don't stay indoors, they still see each other and they're infecting each other. So they're increasing cases up here. And we know that for every 100 cases, 20 need a hospital bed, 5 need an ICU bed, 2 need a ventilator, 1's going to die. So now we go 300, 5 more days, we're at 600. And, you can follow this out. Let's do the math. 5 more days, and we'll just, for sake of argument, do it this way. 5 days, 10 days, 15, 20, 25, 30 days. So, all right, this is not to scale, obviously, but let's just assume these are 5-day intervals. 300, 600, 1200, 2400, 4800, 8600. Let's just call it 16,000 at this point. 32,000. Let's do a few more doublings. 64,000, 128,000 deaths a day. And we can tell you in the United States when that's going to happen based on knowing our doubling date. So today is 150 in 5 days, 10 days, 15 days, 20, 25, 30, 35, 40, 45, 50, 55 days from now, less than 2 months from now, if we don't do anything, we'll have 128,000 people dying a day in our country. We don't have, we don't have that many ICU beds. And every one of those 128 is going to need an ICU bed. We're not there. Hospital beds will all be filled up with ICU patients. We don't have the staff. We have a nightmare. So we have to change the doubling date rate. We need to slow this down. We need to change this. If this is 10 days before doubling, then you've got a long time for everyone to get prepared and get ready, figure out what best treatments work to do this, figure out through an finger stick blood test who's had it, who hasn't. Once we get that under control, we can stop the doubling rate and reverse it. And what you end up seeing in a disease is this logistical curve that essentially you have this low growth, is what we're seeing now, and then it starts picking up as it doubles and shoots up really high until at some point either everybody gets infected and immune, or vaccine comes or something, and then it starts to level off and go stop. And these are the full total number during this time of people who've had it, or people who've died, or anything. And the goal is, how do we move this graph to be more slowly like that? Because somewhere right around here is the ability for us to manage all these patients. And when the healthcare system shuts down, it means there's no healthcare system for anything like heart attacks and strokes and falls and overdoses and all the things that we were dealing with before COVID. So that's why you need to shelter in place right now until further notice. All right.